Hello everyone. In this video we are going to see about nasogastric tube feeding in children. I am Dr. Celeste Mary, Vice Principal in Administration at Triplum College of Nursing. Objectives. By the end of the session, learners will be able to define the term nasogastric tube feeding and list the purpose of nasogastric tube feeding and enlist the indication for the procedure and discuss about the types of tube feeding and enumerate the articles needed for the procedure and describe the procedure of nasogastric tube feeding. Definition. This nasogastric tube feeding is also called as gavage feeding, which means artificial method of giving fluids and nutrients. The process of feeding with the tube inserted through the nose, pharynx and esophagus into the stomach to provide nutrition to the child. Next, about the purpose or objectives of the procedure. It means to feed the children who are unable to take feed orally and also to feed the child who are undergoing oral surgery like cleft lip, cleft palate and the conditions of difficulty in swallowing, etc. And to provide adequate nourishment to child who cannot feed themselves and also to administer medication. This procedure is used. Next, about the indications. The child with unconscious or semi-conscious and the condition is not supportive to take large amount of food orally. Example of severe burns, malnutrition, prematurity and acute and chronic illness, and condition when the patient is unable to retain the food, example vomiting or maybe the anorexia nervosa, recurrent episodes of aspiration, poor oral intake of the diet, and the child with head and neck injury. This procedure is used. Next, we can see about the types of tube feeding. First is the intermittent type, that is a feeding tube may be inserted and removed at each feeding. Indwelling type of feeding, that is a feeding tube is inserted and left taped securely and it is used for a long usage purpose. Bolus, the tube feeding that is given like a meal and it is a larger amount is given in short period of time, usually less than 30 minutes. And about the continuous feeding is defined as delivering the enteral nutrition with constant feed for 24 hours via nutritional pump. Next, we can see about the articles needed for the procedure. A tray containing Macintosh with towel, formula feed, measuring cup or ounce glass to measure the feed, large syringe and water in the container to clean the tube after feed, stethoscope to test the location of the tube and also the bowel with water to test the location, kidney tray for receiving the waste. Moving on to the procedure. First, we have to explain the procedure to the mother or the caregiver. Keep the articles ready for the procedure and place the child in a semi-fowler's position and then perform the hand hygiene. Wear the clean gloves. Prepare the prescribed amount of food ordered and ensure the formula in a desired temperature. Place the towel over the child's chin and the chest and check the placement of the tube by auscultation method and then remove the plugger from the syringe. Clamp the tube and attach the syringe to the feeding tube and then pour the pre-measured amount of formula feed into the syringe and open the clamp and allow the formula feed to flow by gravity. And then continue to pour before the syringe is empty to prevent the air entry and add the 5 ml of water for irrigation when the feed is almost completed and allow it to run through the tube. Disconnect the syringe from the tube and then clamp the tube and close it with the cap. Remove the disposable gloves and place the child in a comfortable position and then replace the articles. Document the procedure, the day, time and the amount of feed given, and these are the systematic steps you have to follow for the procedure. Thank you.